Hi, we're a group of 4th year MPharm Pharmacy students at the University of East Anglia, and we would like to introduce a new community pharmacy service called Parents and Children Together for Health, or Pact for Health, for tackling childhood obesity in Boston, UK. In this video, we will explain why do we want to tackle childhood obesity, why is this a problem in Boston, what is our service proposal and how is it going to work, why our service will be effective. So let's start with, why do we want to tackle childhood obesity? Childhood obesity in the United Kingdom is a growing problem. It has hit an all-time high in children who are in their final year of primary school, with 20.2% of children being measured obese, including 4.4% who are severely obese. Obese children are at a higher risk of going on to be obese adults, predisposing them to significant health risks such as heart disease, high blood pressure and diabetes, as well as lowered self-esteem and body image. This puts significant financial pressure on the NHS. It's estimated that in 2014-2015, obesity-related ill health cost the NHS £6.1 billion, and it's predicted that by 2050, the cost of this to the NHS will be £9.7 billion per year. Why is this a problem in Boston? The prevalence of obesity in Year 6 children in Boston is the highest across the East Midlands region. 27.1% of Year 6 children were diagnosed as obese in 2018-2019, and no improvement was shown from previous years. Overall, the percentage of obese and severely obese Year 6 children in this region is increasing, and in the last 5 years it's risen by 5%. What is our service proposal and how is it going to work? Parents and Children Together for Health will be a community pharmacy service which will target children who are currently in years 3 to 6 and their families. Children will be referred to the program at their local pharmacy by the school nurse if their BMI is over 25. With our marketing strategy, self-referral will also be an option. The parents will be actively involved in the process, and therefore the program should reach out to the entire family. A smartphone app and a booklet will be designed as part of Pact for Health. The application will act as a health diary for each individual family member, including BMI and body measurements, a food diary, and tracking of their pharmacy consultations. The booklet will contain different healthy recipes, local walking routes, and the local sports center activity timetables. E-learning will be available online to train pharmacists and healthcare assistants to run consultations with families and the service as a whole. Initially, the pharmacist will talk to each family member to see what they struggle with. This will allow for each person to be signposted to the most beneficial part of the app and booklet. Maintenance of the service will be ensured by planned monthly meetings between the pharmacist and the family in advance to measure progress and BMI. Once the family feels comfortable and confident with their progress, these meetings can be changed to 3 to 6 month gaps. Why our service will be effective? In first place, our service is based off NICE guidance for obesity, which suggests that any program to prevent obesity in preschool, childcare or family settings should be targeted at both diet and physical activity, hence why we've put these two components as our focus. Secondly, there is evidence showing that there are obesity prevention services outside pharmacies that are comparable to ours and promising success. For example, Planet Munch Healthy Eating Lifestyle program used interactive nutrition sessions where adults and children learn together over 24 weeks to keep engaged. This program met all NICE guidelines and showed effectiveness at reducing obesity risk up to 2 years after taking part. Thus, following strategies of similar programs can help monitor our service. Lastly, we looked at studies to see what primary care service components had evidence of being effective for weight loss and ensured we did cover these in our service. For example, focus on diet itself often lacked evidence of being effective. Self-reporting introduced bias and inaccuracy in other services. School as a body on its own had poor results on weight loss control without primary care support. For all these reasons, we made sure that Pact for Health meets all NICE guidelines, focuses both on diet and exercise, combines both the support of schools and primary care by modern and convenient ways in addition to professional counseling and accurate monitoring. For more information about our business proposal, please feel free to read through our document. There are more details about how the service will be run, marketing, clinical governance, and cost effectiveness. Also featured are a poster for promotion and participant feedback forms. Targeting obesity at a young age and introducing healthy habits early will reduce the likelihood of obesity as an adult and therefore improve quality of life and save future costs to the NHS for related diseases. Thank you for watching this video. Pact for Health.